Hello, everyone. I'm Angela Rosa DiDonato.
And I'm Marian Leary.
And you're listening to Amplify Nursing, a Penn nursing podcast supported by the Pinola Fund for Innovation in Nursing.
Amplify Nursing features nurses who are leading the way in science, policy, and innovation.
Our guests defy stereotypes, define practice, and disrupt convention.
We highlight the breadth and depth of nursing influence on society by amplifying nurses who are pushing boundaries and breaking down barriers to build a new paradigm.
Home is the best place to grow leaders and have leaders, that are going to do great things. And I always feel like every one of our students can do great things. So I'll be here helping them do what they want to do.
In this episode of Amplify Nursing, we explore what it truly means to lead in nursing through a candid conversation with Dr. Dawn Bent, the program director of the Nurse Anesthesia Program at the University of Pennsylvania School of Nursing. Drawing on her journey into nursing, shaped by family influence and a willingness to say yes to new opportunities, Dr. Bent reflects on leadership as a practice rooted in humanity, observation, and collaboration, rather than authority or title. She shares how her experiences in clinical care, education, national service, and even sports have shaped her approach to developing confident, team-oriented leaders. Ultimately, this conversation highlights how effective leadership is less about being in charge and more about lifting others, fostering growth, representation, and empowering the next generation of nurse anesthetists to lead with confidence and purpose.
So, hi, Dawn. Thank you so much for agreeing to come and talk to me today.
Thank you for having me, as usual.
Yeah. It's a pleasure. It's an absolute pleasure. So we're talking this season about leadership and the importance of leadership in all different aspects of our work in nursing. So let's start with what brought you into nursing. How did you get to where you are now? And then we'll kind of segue into some of your philosophy on leadership, because you lead in several different capacities.
Sure. So what brought me into nursing was really family. I had a lot of family members that were in healthcare. My aunt specifically is a nurse, and I'm just kind of following in her footsteps. How I got to where I am today, I think we've probably talked about it ad nauseum, but it, just situational things where you're just saying yes to the right opportunities most of the time. And sometimes questioning yourself whether is this the right move for me, or, can I move a program into the right direction or move it into a direction that makes sense? And that's sometimes looking at yourself. Everyone talks about imposter syndrome, and they don't recognize that even sometimes as someone who's in leadership, you kind of feel that way too every now and then. So, but you work through it, or you go, yeah, I'm doing the right thing, or we're doing the right thing. So that's kind of how I got to where I am now in nursing.
So when you think about, I guess we should start by saying your job is the program director for the nurse anesthesia program at the University of Pennsylvania. So that's a really big leadership lift. Over 70 students in a really high-speed profession. And it puts you in the national spotlight too, because it's such an important program. So considering that, like, what's your leadership philosophy when you think about, like, how are you going to lead the program?
Sure. So I don't think that leadership just comes in one flavor. And a lot of times you're not leading from the front, you have to lead from behind. Um, I think that people forget that you can lead no matter where you are. And in our program, just as far as even the students, like we'll have first year students like speaking at conferences and things like that. And it's not about being perfect. It's about just taking the step forward. And that's kind of how they start their like leadership journey. So I think that, thinking about it, it's twofold. You have to have the right people around you as well. You have to have examples that you can emulate too, but you also have to be willing to step back when it's kind of not your strong point and understanding that, I need to see how this looks first before maybe I take a leadership role in it. But that's not you not being a leader. You are actually being a leader because you're understanding that this is not where my strong point, but I'm going to sit back and kind of see how it looks on somebody else and how I can make it my own. I think we lose that sometimes when you're given a title. You think that you're the be all and end all to all the things. And that's not how it works. And that's not how leadership works. I mean, leadership really is not about yourself, it's about the people that are around you, making them better people as well. Once you're making them better individuals, they're going to be better leaders too.
Yeah, I agree. And I think that too, I think it's really important I think it's important in nursing in general.
Yeah.
However, it's important in the CRNA profession because often we can make or break whether or not the room is going to run efficiently. You know what I mean?
Yeah.
Like we
I
can make
totally
or break
agree.
the make or break the surgeon's whole day, whether or not, we can handle what it is that they need us to do in order to take care of these patients. So
Yeah.
it's getting this group of people and teaching them all to be confident leaders in their own skill set.
Yeah. Like exactly. I mean, like the example you gave in the OR, it's such a different command, I think. And it's almost like when you're at the head of the bed as a CRNA, you already feel that natural like I'm in charge, if you will, and that's in air quotes. I'm in charge, but the way that you utilize that authority in a room, like you said, can make or break a surgeon's day. It can make or break the efficiency of the room, the OR in general. So even though, yes, I'm at the head of the bed, I'm in charge again, if you will. Um, it has to be a situation where I understand too that being a leader doesn't mean I'm always the right person. I'm always right in the decision that we make for a patient. um, Being able to collaborate with individuals, whether it's the circulator or the surgeon or another service that might need to come in and do something while the patient's asleep. So I feel like sometimes people use their position at the head of the bed to say, I'm the authority, but the authority doesn't actually make you a leader.
Yes, that's an excellent point. I think
Yeah,
that we see a lot of that out in the world today where
yeah,
somebody thinks that the authority makes them the leader.
correct. Yeah, yeah.
So, thinking about what makes a good leader, what are some of the life experience you have found that have been helpful in your life that have given you insight on what it means to be a good leader?
Sure. I think my superpower as a leader is actually not saying a whole lot. And I think it's surprising every now and then to people that, I do a lot of observing and seeing how the room is. And I think I'm a pretty good reader of the room as well. So that to me, like, exemplifies my leadership. I don't come in, guns a-blazing and this is what's going to happen, but more so like seeing how other people are reacting, where things are going, and so on. So that's kind of my strong point as a leader is that I lead from different directions, and it doesn't have to be like I said before that, oh, I'm in charge. You have the title, like that's why you're a leader. That does not make you one. And if it did, I don't know. There's a lot of people out there like not doing what they're supposed to do as far as leadership, but um, most importantly, like I can't even stress it enough, is that the more people you bring behind you as a leader, the more you can push them in front of you. And that's like what you want to do. I don't always want to be in front. I want other people to be in front and maybe they looked at me as a mentor, preceptor, or something like that, and they want to emulate me. And, them doing so is me putting them in front of me. And that I think really exemplifies what leadership is all about. It's not being the boss. I don't like to be the boss. Sometimes I want to be Robin. I don't want to be Batman. And that's okay because he had his own set of things, and he meaning Robin, sometimes he was like, Batman, we can't do that. And that was him showing his leadership of being the little bird, if you will.
Yeah, that's a great analogy. Um, so I know too, I mean, obviously we work very closely together. We have
Yeah.
a really good personal relationship. So I know a lot about you that people listening to this may not necessarily know. But
Mhm.
what influence has sports had on how you look at leadership?
Oh, sports is great. And from, well, you already know, but I'm an avid sports fan. I don't even care what the sport is. I'll find something that really intrigues me about it. One of the things about sports is it teaches teamwork, it teaches collaboration, it teaches falling back and moving forward. So it really gives people a handle on what their strong point is and what their strong point isn't. Relying on teammates. I mean, if we're playing doubles tennis, well, am I the one who should be at the net or should I be the one in the back? It just depends. And either role presents a leadership quality to it. Um, but yeah, sports is great. I mean, people who compete in different activities, especially those who are on team sports, like they just get it. They understand, you know, I'm not always the best one on the team, but what I bring to the team is invaluable. And I think that's the biggest thing that sports has shown me, and just being around it for my entire life.
Yeah, I think it's such a great example of practicing leadership. Like people
Yeah.
don't talk about that part of it, right?
Yeah.
It's like you're a natural born leader or you're not. And I really don't
Yeah.
think that that's true.
Me
I
neither.
think that there are strong personalities that tend to come out in the front, and often people will fall behind that loud voice.
Yeah.
But I think leadership is something that really needs to be practiced. And I think that sports is a great example of where a person can practice their leadership and learn from the people around them as to
I
what
agree.
works really well to get people motivated.
Yeah, I agree with that. Totally agree with that.
Yeah. So, how about you talk about some of the things that you've done to practice leadership because there's a lots of practicing going on.
Lots, so much practice. Um, well, with the on our national organization, for example, the AANA, I'm on the Leadership Identification Committee. And when I was elected to that committee, I was like, "Ooh, what am I doing? Like, how am I going to be able to identify leadership in other people?" And again, just sitting back and watching people do their work. And you're like, okay, yeah, this person is a leader. They may not see it yet, but they are. So identifying leadership within the CRNA community, to run for different offices within our national organization and things like that. Um, the other aspect is with the NBCRNA, I sit on the board of directors for that organization, and I'm on the Leadership Development and Nominations Committee. And oddly enough, it was funny because one of the reasons I wanted to be on the board for the NBCRNA was that I wanted to learn different ideals of leadership that maybe I didn't have instilled in myself that I saw in other people that were on the board. And I just really wanted to see how they presented themselves, how they, showed their leadership. And I think when you're looking at like a board position or something like that, you really have to think about why you want to do it, right? And that was my main reason, is that I did want to learn from other people that I know have been CNRAs for a while, have been on the board of directors for a while, and things like that. So they put me on, like I said, the Leadership Development and Nominations Committee, which was last year. And I was like, oh, this is great. Like, I'm just going on and going to the meetings and like listening to all the things. And then when we had our board meeting last year, they're like, okay, Dawn, you're the chair of the committee. And I was like, wait, hold tight, why is what I asked myself. Of course, I didn't ask that question out loud, but just like I wanted to be on the board so that I can develop leadership within myself. Well, here's my chance, to show the leadership that not only I had, but that the board helped me develop as well as a person. So I think that as nurses, as CRNAs, it's really important to get out there and do things that maybe you're uncomfortable with. But those are the things that are really going to help you grow as a person, as a practicing CRNA, as an educator, as a leader as well. Staying stagnant, it's fun because you know what to expect, but the other part of it is that when you're sitting stagnant and not like reaching out to things that you normally wouldn't do, that's you're not gonna grow from that. And I think that no matter what age you are, I mean, that's ultimately what we want to do is grow as people and grow as a profession.
Yeah, I agree, and I think some of the best leadership opportunities that I've had have been helping our students grow
Yeah.
and helping our students to really come into their own in terms of being a leader.
Yeah, and I agree with you on that. It's funny how many times they'll reach out to one of us, about a situation and they present it to you and they ask you like, "Oh, hey, how would you handle X?" And we give them what seems like, "Oh, well, anybody would do it this way." And they're like, "Gosh, why did that make sense and I didn't think about it?" And it's just a matter of I feel like one maturity as far as, and I don't mean they're not mature. I do definitely mean maturity in the profession, and how we would manufacture our leadership skills in dealing with other people because you can't always just pop off at people. That's never gonna fly. And it doesn't sit very well. And it's just not the right thing to do in a collaborative environment. But yeah, our students, I'm really excited about each time they're in their second and third year and graduate and they reach back out and they're doing so many things with organizations and being the president of this organization or developing some educational something or another lecture content for a program or even for our program for that matter. That really excites me, and that just those things, just instilling that leadership quality in them, it's really something I think that sets apart, our program from some other programs across the country. And that's really important to me. I know it's important to you too.
Yeah, yeah, agreed. I think, well, I think we're both very strongly aligned on the basics of what the program means to both of us.
Yes. Hmm.
And I think that this is something that's really, really important is the opportunity to bring citizens into the profession, people who are going to be interested and paying attention and who want to help to contribute to the community of nurse anesthesia.
Yeah, I agree with you on that.
As one of only a handful of Black female program directors in the
Hmm.
country,
Yeah.
are there are there things that you think have helped you or things that you think have been challenges for you um, because of that fact? Because you're very much in a minority in terms of leadership in nurse anesthesiology.
Yeah, so that's such a good question. Sometimes it's funny because I look at it like, oh, you're doing the work that's just out there. Let's consider being colorblind in the work, right? That's the easiest thing to say. But then when you you sit down, you're like, There's 141 programs out there, and the amount of program directors that are one, Black women, is low. I don't know the exact number, but easy to find. Um, and then you look at just minorities in general. I mean, it's not indicative of the population that we have for CRNAs. What do we have? 56,000 CRNAs across the country, and only 4% are Black individuals. Um, so even though you can look at it like you don't need you don't need to bring that into the equation, there really does need to be an aspect that we have to bring into the equation. There are different things that I think about. I walk in a room and I'm always a Black woman, okay? And it's not anything. I love it. It's not a bad thing. But you sometimes think about, like, okay, in a room full of individuals that aren't like me, like what are they thinking about me or the way that I present myself and things like that. One of our faculty, Dr. Dante Flanagan, he started last year with a multicultural conference for CRNAs. And the experience there has been, you look at it and you look in a room full of minoritized individuals, whether you're Black or Asian or, you know, just individuals that, I mean, LGBTQ, any kind of minoritized population that you can think of that runs within the CRNA community are in the room. And the topics they talk about, imposter syndrome, microaggressions and what that looks like, super, super important. And for him to pull together a conference like that garners a lot of CRNAs from across the country, he's showing, his leadership um in the need for a conference like that. We all go to our state conferences and we go to our national conferences, but you feel a little bit drowned out. And does my voice matter? I mean, yeah, it does. And I told him on multiple times, like, I can really appreciate how you took the lead on presenting a whole conference. It's, I think, 3 days, 2.5 days at least, and just for you to be yourself in a room full of people that, are represented like you are. And that really means a lot. And it took a lot, I think, for him to pull something like that together, one, and to have people support and back that as well. Um, but I mean, I could talk about that for probably days, because every time I come back from the conference, it's like, oh my gosh, what about this? Or what about that? Or, what about the other thing? And you think about it. But there's a lot of leaders that we don't normally look at in those rooms. And what's nice about it is you see students are there too, and they see that everybody wants them to be successful. And that's like something that's really super important to me as well.
And the thing that I really can appreciate about Dante's message and the conference that he puts together is
Hmm.
it's for anybody who's interested in
Yes.
participating in literally like what you said, a multicultural experience.
Yeah.
So it's not I think it's really unique in the sense that there have been, a lot of organizations that will separate people out,
Yes.
and he's just kind of inviting everyone in.
Yeah. No, it's the experience is great. Like, you're exactly right. You hit the nail right on the head with that one. He does not care who you are. There are, you know how it is. Like, we want to know about other people's cultures, and that's where you go. I mean, if you have an event that's called the Multicultural Conference for CRNAs, there's no better place to be to figure out, like, about different people's cultures and how what's important to them and things like that.
Yeah. Yeah, that's fantastic.
Yeah.
So, what do you see coming up on the horizon in terms of leadership? Like, what kind of goals are you setting for yourself moving forward?
Oh my goodness. So, well, to continue on the, board of directors for the NBCRNA and in the leadership development and nominations committee for that. Um, it's funny because sometimes I think I want to be more involved at a higher level in some of our national organizations. And then I look at like the needs of the students and I kind of peel myself back because I'm like, well, if I'm doing all of this for me, I feel like a little bit selfish and that's just how I am. Um, I'd rather give back to them, help them achieve whatever goals they set out to. There were a couple students that we've had recently that graduated, and my gosh, the way that they're just taking off in, just ways that I didn't expect and individuals that I didn't expect because sometimes you know how it is in the program we look at people and like okay that person's like a little more boisterous, not in a bad way, but I can see that person doing X and it's the little people I call them, the little people that never thought that they could do this. They couldn't be an anesthetist because somebody told them they couldn't do it, and all of a sudden they are like blossoming. I'd like to think that part of it is because of what we instill in them, that it doesn't matter what people say about you. You can do whatever you want and you can be a leader in wherever you want to be a leader. Um, so I sometimes I battle with myself in, okay, Dawn, you should be doing a little bit more like nationally, but then I'm like, you know what? Home is the best place to grow leaders and have leaders. That are going to do great things. And I always feel like every one of our students can do great things. So I'll be here helping them do what they want to do.
Hello, Angela.
Hello, Marion.
I loved your interview with Dawn. I mean, I am a huge Dawn Bent fan anyway, but this interview made me love her even more for so many reasons. And we can jump into them, but like, God, what a great interview about leadership. It almost felt to me like that was like the utopia of what a leader should be in what she was saying and how she goes about embracing leadership. It was great. I really enjoyed it.
Yeah, I think that I've learned so much working with Dawn over the years. And I think we complement each other really well in terms of our styles. And she's really so impressive. And I think the thing that works for our team that her and I have built together is that it's student centric. And she talked about that over and over again throughout the interview, how it's all about how do we set an example so that the students that are coming up can move into their full potential.
Totally. And, just saying all of the things I always hope leaders are thinking and would be saying, and she practices it, right? Like, she's talking about anyone can lead. She doesn't always need to lead. And like, it's okay to share space with others and encourage, like you said, like the students to step up and lead and give them that example on what leadership actually means. It's not authority. That doesn't make you a leader. It really is, how you put yourself out there, how you mentor students and other colleagues and help raise other people up. I just loved every part of that conversation you had with Dawn. And it was so refreshing to hear. I think at a time where, leadership is all over the map in many areas.
Yeah. And I think too, there's such a focus on leadership. And I think, and I'm sure you see this too, like LinkedIn, like there's all of these different webinars and conferences and I don't know how you feel, but I've stepped into some of those to be like, what can I learn from this? And it's like what I learn is how to manipulate people. And it's really it really is. And it's like, huh, that's a really interesting take on leadership. Like how can I manipulate everyone to think that I should be in charge of all the things? And in a time like this, to have someone who is so visible and especially on the national stage in the CRNA profession, Dawn sits on national committees. She sat on our state board. She sits on the board of our accrediting body. Like she is a presence that offers something to look up to.
Yeah, totally. Couldn't agree more. And with such humbleness, like, she talked about imposter syndrome. She talked about how she doesn't say a lot. She, watches and observes, like such great quality of a leader to like not always have to be the one up front, not always have to be the loudest, but really paying close attention, observing, and taking it all in. Yeah, I mean, I'll just keep saying it. It was just a great conversation and such a uh, impressive leadership style that I wish was emulated by others.
Amplify Nursing is hosted by Dr. Angela Rosa DiDonato and Marion Leary and produced by the University of Pennsylvania School of Nursing, with special thanks to Jonathan Zhu for his assistance. Music for the podcast was created by Harper Leary. The podcast is made possible by the Krista and Rich Pinola Fund for Innovation in Nursing.
Follow us on Twitter at Penn Nursing. Until next time, keep pushing over, under, around, and through.